And what the tax is meant to do is to incentivize the employers to raise wages versus raising premium benefits. So if you're getting really expensive plan packages for your employees so you don't have to pay them more, the Cadillac tax is put into place to discourage that and really encourage higher pay to your employees versus just giving premium health care plans. While it was highly criticized on both sides of the aisle. Democrats didn't like it, unions didn't like it, employers didn't like it, Republicans didn't like it. It was meant to be a way of funding the Affordable Health Care Act into the future, but also really promoting higher wages. The thing is that it is likely that is off the table now. That's going to go away, but Paul Ryan has already in his plan, and who knows what will be implemented, but he is already talking about a cap on the cap on the exemptions that employers can take for their employer healthcare policies, which will in effect do the same thing as an excise tax. So both sides are trying to reach the same goal, just in different ways. So one goes away, something else will be put into place that will likely have the same effect, which is a real push for employers to be raising salaries versus quality of benefits. One of the big things that you'll likely see, and a really key focus of the Republican administration, is increasing flexibility in health savings accounts, flexible spending accounts, health reimbursement arrangements. So you'll see a lot of push for laws and regulations to allow for more flexibility in these types of alternative health savings plans. With that, you might have more of a demand for those type of benefits in the workplace. You should definitely consider these options moving forward as you're sort of weighing the benefits of the different types of health insurance benefits that you're going to be offering your employees. One of the biggest pushes is to have the health savings accounts allow for the purchase of over-counter drugs. What this allows is basically pre-tax savings that go towards health spending and is a real benefit to employees. So we'll see a big push in this administration for having those type of benefits versus premium health care plans. The one thing you should not expect is for your health insurance to go down. And that's kind of the biggest, I think probably one of the biggest myths about Obamacare or the Affordable Health Care Act is the rise in premiums. Let's face it, the premiums were rising at astronomical levels before the Affordable Health Care Act. They will continue to rise at astronomical levels after. We're going to see the exchanges being dismantled. There's going to be a lot of uncertainty. It's going to freak out the insurance companies. They're going to raise their rates to make up for the fact that 1.7 million people are going to be dropped, that they're not getting federal subsidies. We're also going to see healthcare providers raising rates, because there is going to be an influx in people visiting emergency room and non-covered medical services, and they're going to have to make that up somehow, and that will be reflected in the premiums that we get as individuals and as employers. So that is probably the sum of all of my knowledge about this, which is about that much. So any questions? Thank God? No. Thank you.